So mostly the actions we are going to talk about today will be happening at synovial joints. Why does that make sense? Because they're the wiggly ones, right? Okay, so not all of these are synovial joints, but the vast majority of them we're talking about today will be at synovial joints, okay? And this is not meant to be a comprehensive list of every single thing that muscles do, but it's the one that I know will reinforce what you're actually learning in lab, okay? So the body movements are really the connection between the muscular system and the skeletal system. So that's why we're moving into this right away. So they're directly related to muscle action. So one of the things that I have to get across to you guys about is that when we're talking about anatomy or in physiology, you don't use the words to mean the same thing as, for instance, when you were in the gym. So for instance, if you go to the gym and somebody says, flex your tricep, you know what the hell they're talking about. But I want to tell you that in anatomy, you do not flex muscles that are not flexors. A tricep is an extender. So you have to be really specific about what you're saying, right? And realize that we don't use the terms the same as the sort of common usage of the term. And so that's what we're going to get used to today. So first off, we're going to talk about what we call this set of what we call angular movements. And angular movements, what they're going to do is always assume that you start from anatomical position unless somebody tells you different, okay? Angular movements are going to start from anatomical positions, and then they're going to change the angle between two bones, right? So, or at least two bones. So is this an angular movement? Yes? But is this one also an angular movement? Yes. Yeah? Okay, so let's start talking about that. So the first set of angular movements we're going to do is the pair called flexion and extension. So let's talk about flexion first, okay? So flexion is defined as starting from anatomical position, right? Decrease the angle between two joints, meaning that you have to know what the angle was originally. So if I'm talking about this joint, what's the anatomical position angle of this joint? What is that? 180-ish, right? Okay, let me move this over so I can have one more. Arg. Okay. So that's 180. So let's talk about flexing that joint. So if we start from anatomical position and we do flexion, we're going to reduce the angle of that joint. Extension, we'll talk about in just a second, is generally replacing it back to anatomical position. Okay? So what is flexion going to be? Flexion, extension. Okay? So what is usually going to be true is that flexion is usually going to be occurring this direction. So watch me flex here. Flexion, extension, good. At the hip, flexion, extension. At the neck, show me flexion. Flexion, extension, good. So do you see, with that in mind, and there is one exception, that the muscles responsible for flexion should therefore, the vast majority of the time, be on the what surface of the joint? Anterior surface of the joint, yes, anterior surface of the joint. So it's a decrease in joint angles. It brings two bones closer together. So let's look at this example of flexion. And now I want you to look at it and try to tell me what joint it is flexing, which should be pretty easy. And then also where approximately the origin and the insertion are. What joint is it flexing? Elbow. It's not moving the shoulder. Shoulder's staying stationary. Okay? I'm not saying it couldn't because it actually crosses the shoulder, but the action you're looking at is flexion of the forearm at the elbow. Yes? Flexion of the forearm at the elbow. Approximately, where's the origin? All the way up here, more proximal. Yes? And where's the insertion? Below the elbow, because you have to cross the joint to move the joint. Reinforce that 3,000 times, right? So this muscle could not, of course, flex the wrist. Yes, it couldn't, okay? But would you be at all surprised if later you learned that it has a minor action at the shoulder? Yeah? Okay, we're not talking about that action right now. So this is flexion, but this one is also flexion. So okay, this is flexion of the vertebral column. Good. Or flexion of the abdomen. Where's the approximate origin, approximate insertion? Where's the origin? Origin is not there. Yeah, it's counterintuitive, right? Everybody wants to be up here, but the origin is actually down here. That's the one that stayed stationary, and then the insertion is up here, and that's the one that moved, right? Because, of course, you guys told me that last time you understood that a muscle's action is always to pull, never push, right? And the action is going to be to bring the insertion closer to the origin. Good? So that is flexion. Now, there is one example that breaks the rules of flexors being on the anterior surface, and it really is because we actually evolved from being a quadruped, and then this joint right here ended up being really specific to what it's doing here. So this is the 180-ish degree angle, right? Okay, but the knee only flexes and reduces the joint angle this direction, right? So knee flexors are the exception to the rule. They're on the posterior surface, and then the foot is a whole other ball of wax. We'll talk about that one by itself, okay? But why the hell do you care? The reason you care is because this can help you, because you are a bright person, and once you get used to this stuff, you will never go looking for the flexor carpi radialis on the backside, will you? No, because that needs to be on the anterior side. Yes? Okay. You will never tell me that the bicep does extension, because the bicep is anterior, it's going to do flexion of the elbow, right? And the extensors we're going to see are going to be on the opposite side. Does that make sense to you guys? Okay, so now let's talk about its pair, which is extension. Extension is increasing the joint angle, but usually what it's doing is it's replacing it to anatomical position. Okay, so I'm showing you extension of the forearm at the elbow. Okay, this was flexion at the hip. This is extension at the hip. Okay, this is flexion of the vertebral column. This is extension of the vertebral column. Will you guys show me flexion of the neck and extension of the neck? Flexion of the neck, extension of the neck. Okay. If you go past anatomical position, and some joints can and some can't, it's hyperextension. Okay. Flexion, extension, hyperextension. Yes? Good. Flexion, extension, hyperextension. Good. Now, some joints can't. Flexion, extension, don't hyperextend it more than once, right? Flexion, extension, hyperextension, no hyperextension. Same thing here. Flexion, extension, no hyperextension. Good? Okay? At that particular joint. It just depends on the mobility of the joint, whether you're able to do that. So, generally speaking, joints that are responsible for extension are going to be on the what surface of the joint? Posterior. Yes. Okay? So, I have a whole set of muscles called wrist flexors, and I have a whole set called wrist extenders, right? They're flexor carpes and extensor carpes. Show me wrist flexion. Yes, that's wrist flexion. Show me wrist extension. That's wrist extension. Yes? So the muscles responsible for flexion are going to be on this side. The muscles responsible for extension are going to be on that side. Does that make sense? And that will help you to not say, I know that there's like 17 muscles there. Yes? And they're all a bunch of little bastards. I totally agree with you. But there is a way to figure out what they are not. And that's a good start, right? There's a whole bunch of shit that could not be, right? I've narrowed it down to 3. Let's see if I can get those 3 right, okay? So flexion, extension. So let me show you extension. And again, same question. I want you to try to figure out where the origin and insertion are for these muscles. These muscles you're going to learn next week. What is this action? Extension of the vertebral column. Yes? Yeah. And where are the origins? Origins at the super. Yeah, down here, and the insertions are further up. And by the way, these muscles are sequential, so if you've ever taken yoga and they tell you to, for instance, roll up your vertebra, you can do that because this one inserts here, but this one inserts here, this one inserts here, right? Okay. These are called the erector spinae muscles, and this is extension. Does that make sense to you guys? Very good? Okay. All right, so that's the first set of angular movements. The second set of angular movements are abduction and adduction. So let's learn abduction and adduction. Where are you? There it is. Okay. Abduct, as in to kidnap, takes anatomical position and then kidnaps something away from the imaginary midline. Abduct. Yes? Adduct, add it back to the imaginary midline. Yes? Abduct, adduct. Some people, to make sure that they know what they're saying, called it abduct and adduct. Now, note to self, if you write one and mean the other, that's not a spelling error. That's just wrong. Okay? So don't try to fudge it and make it look like, oh, it could be a B or a D, because I'm just going to count it wrong as a matter of principle. Okay? So abduct, adduct, abduct, adduct. Yes? Okay. Now watch my thumb. Abduct, adduct, adduct, adduct. Does that make sense?
Yeah.
Okay. All right. So now let's figure out the logic of abduction and adduction. Okay. So this is abduction of the arm at the shoulder. Where's the origins? Up here. And the insertion? Down here onto the humerus. Okay. So generally speaking, what do you think? When you find a muscle that is responsible for abduction, it's very likely to be on the blank surface of the joint. Lateral surface of the joint, yeah? That's where you're going to find the abductors, yes? Yes? Abduct, yeah? That's what you're doing, because that's how the mechanics works, okay? And then adduction is, of course, going to bring it back in, okay? Where do you think you're going to find muscles responsible for adduction? Medial surface. And for those of you who have been to lab this week, what do you call this group of muscles right here? The adductors, yeah? There's a longus, a brevis, and a magnus in here. They're all adductors. They all go from here to here and yank that thing in that way, yeah? Those are adductors. Don't call them abductors, because how the hell could they abduct if they were there, right? Okay, and then this one is a little more confusing. Obviously, the deltoid's pretty obvious to understand that it's actually abduction, okay? But the muscles that do adduction, you actually don't have any muscles right down here. But it's okay, because you can actually make it work if you strap them from somewhere else. So does it make sense to you that you could still adduct if you started with the pectoralis major muscle and then inserted it over here? I could still do adduction. There's even another muscle back here. Do you guys know about this one that goes from here up to here? That can help with adduction. What's that one called? Platysma dorsi. Yeah. Okay. The Platysma dorsi. When you work those out, you get that nice triangle shape on your back right there, the lats, and that's part of what they do, right? That good? Adduction. Okay. So, everybody good? Okay. So, I want to show you an action, and it's kind of confusing because you can't quite see the angle between the two joints and figure out if you can understand what's going on. Okay. So I'm going to do shoulder joint action. You ready? Okay. What am I doing here? I'm doing flexion, even though, of course, the clavicle and the scapula do not extend so that you can see the angle. This one was here and this one was here, and I just reduced the angle between those. What am I doing here? Extension of the arm at the shoulder. Yeah. What am I doing here? Abduction of the arm at the shoulder. Adduction of the arm at the shoulder. Okay. So now what we will see is at this joint and this joint, I can actually do all four. When I cannot do all four, it's sort of this complex action. It's not written on your lab manual anywhere because it's really just a combination of 4 different actions. So if you can take a bone and move it like a cone in space, yeah, it's called circumduction, circumduction. And I can do it with my hip, not quite as well, not as much muscle mobility at the hip, okay? But really what circumduction is a combination of 4 other actions. Tell me what they are. So let's do it at my hip. Ready? What action am I doing? Flexion. Now what? Abduction. Extension to hyperextension, and then adduction, right? That's circumduction. All 4 of them, right? And it's primarily just for ball and socket joints because they have so much mobility compared to other joints. Does that make sense? Okay. Everybody good? Questions? Okay.
Can I just make a quick
Sure.
comment? When it comes to adduction, I always just think of ADD, adding together.
Yeah, add, right?
Yeah,
Abduct, you kidnap or take away, add it back.
That's the only way I can
Yes.
remember it. So.
Abduct, take away, add it back. Yes? Okay. Now this one I want you guys to do so you can feel it because it looks like I'm doing one thing but I'm actually doing another. So take your shoulders and put your body in anatomical position for this part of your body. And now what I want you to do is I want you to take your shoulder, your humerus, and rotate it medially. So it looks, if you look at me, like I'm rotating my actual forearm, but that's not what I'm doing. I'm taking my shoulder and rotating it medially. Does that make sense? That is rotating a bone around its long axis, and now rotate it laterally so that it goes back into anatomical position, okay? This is called rotation, okay? And I have medial rotation when I end up more medial and lateral rotation when I end up more lateral. But let's see if you guys can figure out the muscle mechanics of where the muscle should be for each thing. Ready? So, medial rotation, watch. Where is the muscle going to be that causes medial rotation? It has to have an origin where? Anterior trunk, yes. And an insertion where? Nope. You have to cross the joint to move the joint. You have to go out here onto the humerus, yes? And if I inserted it right here, I don't get much range of motion. But if I insert it way out here, I get a lot of range of motion. Does that make sense? Okay. That is medial rotation, yes? And it looks like a forearm action, but you can feel the difference because I can do a forearm action without moving my shoulder, right? Right? But this one, I'm actually doing that. So that's medial rotation. Okay, now lateral rotation. Where's the muscle going to be that does lateral rotation? Posterior surface, origin over here, and where's the insertion? Has to go onto the bone, right? Onto the actual humerus. So this is lateral rotation. Yes? Okay, that makes sense? Okay, before we leave that, does it make sense to you that although you will hate it, sometimes a muscle has more than one action? So let's talk again about the pectoralis major. So I just told you that one action of the pectoralis major might be which duction? Adduction. And now it might be able to also help with the rotation. What would that be? Medial rotation, yes? Good. Whereas the I just forgot the name of the muscle. Triangle muscle.
Oh, Platysma dorsal.
Sorry, brain fart. Platysma dorsal goes from here, right about up to here. And of course it's responsible for helping with what duction? Adduction. And then probably might help with? Lateral rotation, yes? Okay. So you want for the actions to make sense based on how the muscle is hooked up, right? And then in a pinch, you can figure out, well, I don't remember, but it looks like it might do this, right? And then you'll be able to come up with one. Because very rarely do they make you write every single action. You usually have to come up with one action for the muscle, right? Okay, good? Okay, all right, so that's lateral and medial rotation. Other movements. Okay, these movements are kind of specific to certain locations, and this one's specific to a single location. Okay, so this one actually looks the same unless you look closely. This one is a forearm movement, and it is going to be supination and pronation. So if you end up so that you can drink some soup, you just supinated. If you end up so you po it out, you just pronated. Supinate, pronate. Okay, now, which joint is moving? Yeah, it's your elbow. It looks like a wrist joint, but hold your hands really, really still and don't move your wrist and you can still do it. Yes? It's an elbow movement, yes? Okay, so with supination and pronation, what you do is the radius and the ulna and anatomical position are parallel to one another, yes? Okay, and that is when they are supine, and when they are prone, they actually cross over one another. Supinate, pronate, supinate, pronate. Now, those two muscles that you will learn or did learn this week or started to learn, you have a pronator teres. Teres means tube-like. It's a tube-like muscle. I know to look for it across what joint? Elbow joint, yes. And then I have a supinator muscle. But what I want to challenge you guys to do is either when you're looking at an image or preferably when you're in lab, try to figure out whether your logic can tell you which one's on which side. And that's actually kind of a confusing action to figure out where the muscle is actually going to be. Because you got a pronator on one side, you got a supinator on the other. Why the hell is one place and one the other? And how can you make it logical, right? So I'm going to challenge you to go in there and look at it and try to figure out why the hell the pronator teres is on one side and the supinator is on the other, and what it has to do with their actions, right? Okay, so that's pronation and supination. And then these special movements at the ankle are because somebody didn't get the damn memo about the ankle, right? You literally just told me that flexion decreases the angle and extension increases the angle. And then I'm going to call two opposite actions both flexion. Let's flip them all off in our minds, right? Me too. They did it to me too. I didn't get to name these. So let me show you what dorsiflexion and plantar flexion look like if I fall. Make sure you remember me fondly. Okay, dorsiflexion and plantar flexion. Okay, so they're called what they flex toward. If you flex toward the dorsal surface of the foot, that's dorsiflexion, yes. If you flex toward the plantar surface of the foot, that's plantar flexion. Yes? Dorsiflexion, plantar flexion. Okay, now, with dorsiflexion and plantar flexion, if we understand the mechanics, we can figure out where the muscles should be. So where do you think the muscles should be that are responsible for dorsiflexion? Anterior surface crossing the ankle joint, yes? Yeah? Okay, anybody know a muscle that's on the anterior surface crossing the ankle joint? It's on the anterior surface of the tibia. It's called the tibialis anterior. Yes? And I'll bet you $1 million that it is not a plantar flexor. Yes? It's a dorsiflexor, yes? And then plantar flexion is doing this, like standing on your toes. Yeah? Okay. Where's the muscle going to be that's responsible for doing that? Posterior surface, right? And it has to cross the ankle joint. Yes? That's plantar flexion. Okay? So, I'll show you the animation for plantar flexion in just a second. So, and then there's a subtle movement that happens at the ankle. Feel it on yourself because it's not super dramatic. And that subtle movement that happens at the ankle is called eversion and inversion. And so if you start with the sole of the foot and then you move it laterally, that's eversion. If you start with the sole of the foot and move it medially, that's inversion. Eversion, inversion. Do it on your own foot so you can feel it. Eversion, inversion. Okay. Where is the muscle going to be that's responsible for eversion? Lateral. Lateral, yes? Right, lateral surface of the ankle, exactly, right? And where's the muscle going to be that's responsible for inversion? Medial, yes, yes, yes. You got the logic there? Okay, so now let me show you this animation without falling off the table or knocking the table over. Okay, so plantar flexion. Okay, so here's plantar flexion. Do you know the name of that muscle yet? You might already. Gastrocnemius, yeah. Where are the origin and insertions? Origins are, yeah, proximal, up there. And the insertion, all the way down. It's actually all the way down on the calcaneus, and you have so much range of motion because although it's showing it right here, it actually inserts all the way down here. So you get a decent amount of range of motion. Does that make sense? Okay. That is plantar flexion. Everybody good? Okay. So now, inversion and eversion are important. All four of these really are involved in walking, especially on uneven surfaces. So our feet don't just do this. Our feet actually do this as well, which allows us stability on uneven surfaces, right? And if you lose mobility at that joint, you're going to have a hard time with a normal gait. And you're going to have a hard time with uneven surfaces. So you really need to be able to do all of those. Okay, and then these are movements at the jaw. They're easier to see at the jaw, but they also occur at the scapula, and they're hard to see. They're also kind of hard to figure out how to do at the scapula. Okay, so at the jaw, if I don't want to change the angle between the maxilla and the mandible, I can slide it forward and slide it back. So watch. This is protraction, end up underbite. This is retraction, end up overbite, right? Not really changing the angle between the two of them dramatically. So protraction, retraction. Now, on your scapula, it happens there. It's hard to picture, and it's hard for me to show you. If I take my scapula and suck them close to my body, that's protracting the scapula to bring it in. If I stick them out and away from my body, that's retracting the scapula. So, sorry, the other way around. Retracting is bringing close to the body, and protracting is putting outside. I just switched them for you. Okay, and then elevation and depression are a little easier. because you guys can see elevation and depression of the scapula, right? Hold my limbs relatively stationary and elevate the scapula, depress the scapula. Elevate, depress. Yeah? So where do you imagine you're going to find a muscle responsible for elevating the scapula? Posterior surface and elevate the scapula. Superior surface, right? Has to go up here to down there onto the scapula so that you can pull it up. Yes? Not surprisingly, there is a muscle that does that. It's called the levator scapulae. Because it's telling you what it does. Okay? Go ahead.
Just to go over that one more time, protraction is the action of moving your scapula outward.
It's to move anterior.
Anterior.
So retracted. Yeah.
Okay, so
Yeah.
anterior.
Protract. Yes.
Okay.
Okay. So, and then depression. So depress your scapula. Where's the muscle going to be that does that? Inferior, right? Inferior to the scapula. From here to here. Do the same thing with your jaw so that you can really feel it. Elevate your mandible. Yeah? Okay. Where's the muscle? From here to here. Yes? Now depress your mandible. Where's the muscle? From here to here. Yes? Got it? Okay. Elevation, depression. Okay. The scapula is always a little harder for people to see. So when you look at the actions, when you're actually in lab, try to figure out like how the mechanics work for the ones that says for protraction, retraction, elevation, depression. Okay. And then last action, and then we'll practice a little bit with actions, is opposition. And opposition is really this special activity that happens at our thumbs. That's why they call them opposable thumbs, because we have so much mobility that we can actually take the pollex and we can make it touch all of the other digits. That's opposition, right? Lots and lots of mobility at this joint. It ended up being really, really evolutionarily significant, right? That we can do that because it allows us to manipulate the world around us tremendously. If you combine that with a really big cerebral cortex compared to body size, then you get both space flight and global warming. Right? Everything in between. That's why we are in charge and not the dolphins. But we've kind of jacked it up, so maybe it's their turn. Okay, really. So that's opposition. Okay, now let's do a couple of things, and I want to see if you guys can help me figure out the action by looking at it. Okay, so let's do this one. Okay, so look at the joint that moves, yeah? And then try to figure out what the action is and where the approximate origins and insertions are. Good. What is that action? Extension of the leg at the knee, yes? And by the way, this is thigh, this is leg, this is arm, this is forearm. Okay, okay. Extension of the leg at the knee. Where approximately are the origins? You don't know them specifically yet, but you can definitely do them approximately. Where are the origins? Yeah, all the way up there on the thigh, and one of them even goes past the hip. You may or may not know that. And then the insertion is, of course, past the knee. Yes? Has to go past the knee. So is it going to insert on the femur to do that activity? Or how about the tibia? Yeah, there you go. It has to go down there, right? There's a logic to it. Okay, now it's not on this picture, but I will tell you and see if you can figure something out because this confuses the living hell out of students. But it's okay if you actually try to understand it. So this group that you're seeing right here is the quadriceps femoris group. There's 4 of them. We'll figure out why it's called quadriceps in just a second because quadriceps means something specific. 3 of them go from the femur down onto the tibia. Yeah. The other one goes all the way from the anterior inferior iliac spine down here onto the same insertion point. So, does it make sense to you that one of those 4 has an extra action? Yes. What would the extra action be? No, it's nope, running right down the middle. Flexion of the hip, yes, but then what does it do at the knee? Extension at the knee, and students like practically want to throw shit when you tell them that the same muscle can do flexion and extension because they're trying to memorize it. They're not trying to understand it, right? If it goes down the anterior surface of the hip, it can flex the hip. But if it goes down the anterior surface of the knee, it can extend the knee. Yes? Okay, and there's only one of the 4 that actually does it. The other 4 all start on the femur. Is that okay? Okay. Not do you love it, but you know. But can you do it? You can. Just give it a little time. Okay. Let's see. That one's good. Oh, we'll do that one in just a second. Okay, we'll do the rest of those in just a second. Okay, so now what we are going to start to do is we're going to start to look at the logic of muscle naming. So now that we've got something about actions and we know something about locations, we're going to try to figure out what are the conventions that they use to name muscles. Unfortunately, they don't just use one convention. They use a bunch of conventions. And the conventions that they use include, you don't have to memorize this. Muscles are named for their action, their specific body region, their attachments, the orientation of their fibers, their shape, their size. Now, that's not something to memorize. So what you do is you look at the name of a muscle and try to figure out what it's telling you, right? Instead of trying to do it the other way. So we're going to do it with examples that you are actually learning in lab. Most of them you're going to learn in lab. Okay, so the muscle action. Sometimes muscles are named for their action, but now what we just learned is that the action can also tell you the location, yes? That's why we approached it that way. Because if you run into a muscle that's called a flexor, if it's anywhere but the knee, it's probably going to be on the what surface? Anterior surface, exactly. Did you learn any anterior flexors here this week? I hope you did. Yeah? Tell me one. No, flexor. Flexor carpi radialis, flexor carpi ulnaris, right? You got good? Okay. So you've got some flexors. Now, if it's a flexor and it's down here, you do not get lost in the woods and go looking for it back on this side, right? Okay. Did you learn any extensors this week? A muscle that is named an extensor. Extensor digitorum. Yeah? Okay. So what's the difference between an extensor carpi and an extensor digitorum? The second word is telling you the joint that it moves. So an extensor carpi is going to move this joint, and it's going to do that action. An extensor digitorum is going to do that action. Sometimes it'll do both. So let's do the flexion and extension at the wrist and at the fingers, the digits, for a second. So show me flexion of the wrist. That's it. Show me extension of the wrist. That's it. Now show me flexion of the digits. Yes. Show me extension of the digits. Yes. That makes sense? Okay. So your flexor digitorum, they will have tendons that go all the way down into the femur. Into the femur? Into the fingers. Wow. Not that one. That's a long tendon. All the way down into the fingers. Yes? Okay. But a flexor carpi really only has to go past here, right? That can help you when you're looking at the cadaver figure out which one's which, right? Especially on the ones that have beautiful hand dissections. Everybody okay with that? So flexors versus extensors. Did you find any muscles this week, for those of you who have been, that were called adductors? I hope you did. Can you tell me which one? Yeah.
I remember the location. I don't remember the name though.
The adductor pollicis. It happens to be a longus, even though you don't learn the short one just because it's really buried in there. So here I have a logic question for you based on what we've learned. If I have, and I do, at least 3 muscles that control thumb action, there's actually more than 3, but 3 that you have to learn that control thumb action, because the thumb is really wiggly, right? Okay, if I have a flexor pollicis, an extensor pollicis, and an abductor pollicis, and I find 3 tendons running into the thumb, how do I figure out by logic instead of memorization which one's which? Nope, they don't move on the cadaver.
You follow the tendon up to the muscle, where like aren't your flexors are on this side, your extensors are on this side, and your abductors.
Abductor, yeah, abductors.
Abductor, right?
Abductors. Okay, so where are the tendons? In order. You've got 3 tendons running off the thumb right there.
Extensor.
What's going to be on the front? Flexor. That's going to be the flexor pollicis, yes? What's the next one going to be that's lateral? Abductor. What's going to be the back one? Extensor, exactly, right? Because you know that that's actually how it attaches. And then, of course, later you can memorize where they actually attach to so that you can reinforce what you know. But your expectation should be, if there's 3, There's a flexor, an abductor, and an extensor. I know what my expectation is of the order of those tendons. Does that make sense? Because that makes sense based on what you learned. Okay, did you learn any adductors this week? Adductors, adductors. What did you learn? No, the name is adductor. The name of the muscle is called an adductor. Yeah, adductor magnus, longus, brevis, down here, these are the adductors, right? So you know where to look for them because they are adductors, right? And you know that they're not abductors because they're on the medial surface. Good? Okay, so did you run into, oh, you didn't this week, but I'll tell you. Next week you will run into a muscle called the levator scapulae. Can you figure out how much information there is here, right? Where should it be? Be more specific. Above the scapula, exactly, right? And if you have to learn its attachment points, which one's which? If it levates the scapula, which one's which? The one on the scapula is the origin, the insertion. Insertion, and the other one is the origin, because it's the levator scapulae, right? Okay, and then you don't learn this one, but I'll teach it to you. I mean, just so that you've got, I hate it when they're not parallel. There is a depressor muscle. There are a bunch of muscles that you don't learn. The depressor anguli oris is the muscle that does this. Because it goes from the angle of your oris, yes, and it depresses it. So it goes from here to here and does that. Good? And you have to make a sound or else it's a word. Right? That's the depressor anguli oris. Okay? Pronator and supinator, right? You've got the pronator teres and the supinator, and you know where to look for them. They have to be crossing the elbow joint. Good? Okay. And then if you run into a muscle that's called a rotator, we're doing muscle names now. You don't really have a rotator that you learned, but you have a group of muscles that's commonly referred to as the rotator cuff muscles. And among the other things they are going to be doing is allowing for this action to occur at the shoulder. They have other functions as well. So the rotator cuff muscles, so you know that they have to cross that joint, right? That makes sense? Okay. And then sphincters. You don't learn any sphincters this week, but you run into sphincters all semester long. Sphincters are a muscle that actually goes around a tube, right? And most of your sphincters are smooth muscle, but you do have two very socially important skeletal muscle sphincters, yes? You've got a skeletal muscle sphincter at the distal end of your urinary tract called the external urethral sphincter. That's your potty training muscle, right? It's skeletal muscle. It takes you the first 2 to 5 years to get control of it. Boys potty train slower than girls. And then you have also a skeletal muscle sphincter at the distal end of your digestive tract, which is why you're not pooping right now. Thank you. Thank you. Oh, thank us all, right? So it controls, right? And that one's skeletal muscle as well. And then you have a whole bunch of smooth muscle sphincters, a whole bunch of them. Okay, and then you have one muscle that's called a tensor. What's that one? You learned it this week, or you're learning it this week. The TFL, yeah. Tensor fascia, like so many damn vowels in that one. You're like tensor fascia latte. Okay, so another way that muscles can be named is by the orientation of. We can't see the fibers with the naked eye, but we can definitely see the fascicles with the naked eye. And fascicles are really just a bundle of fibers. So what you're seeing right here is, so an individual muscle fiber is microscopic, but a bundle of them will allow you to see which direction the fibers are going, okay? So a bundle of fibers is called a fascicle. If the direction of the fibers is really, really characteristic of the muscle, sometimes they're named for that. So for instance, if you have a muscle that's called a rectus muscle, or anything that has the word rect in it, as in the same root as erection, then the muscle is straight up and down, parallel to the long axis of the body, right? So, of course, you've got, what's that muscle? That's the rectus abdominis. If you haven't learned it before, you will next week. It's rectus because the fibers are running straight up and down over the abdomen, so it's the rectus abdominis, okay? You have another rectus that you learned this week. What was that one? Rectus femoris, because the fibers are running straight up and down over the femur, right? And although this one isn't a rectus muscle, it does have the prefix rect in it, and that's this one right here. This is the erector spinae muscles, yeah? Because they're running straight up and down right next to the spine. Good? Okay, so that's what a rectus muscle is, or a muscle with the prefix rect in it. And then you also sometimes have a muscle that's called a transversus muscle. And with that muscle, what happens is the fibers run almost perpendicular to the long axis. And we have a rectus abdominis and we have a transversus abdominis. And you're going to do that one next week, transversus abdominis. Okay? And then we have muscles that have fibers that are running really obliquely, like at an angle. And sometimes they're called that. So for instance, these muscles right here are called the abdominal obliques. Yeah? And back to this figure for just a second. He will show us his. These are those right there, the abdominal obliques. Okay, so the oblique muscles, we have two of them. We have external abdominal obliques and the internal abdominal obliques. We're going to do them next week, but let me give you a preview. The abdominal obliques, the external ones are external in two ways. They're both more lateral and more superficial. Okay, and you remember what their fibers run like because you're seeing here because they run X to the sex. Yes? Okay. And then the internal obliques are internal two ways. They are both more medial and they're also deeper, and they run into the chin. X to the sex, into the chin. So you can see which ones you're actually seeing right here, right? Which obliques are those? X to the sex, the external obliques. Does that make sense? It's the external obliques. Okay. And then muscles are sometimes named for a body region or a relative location with reference to another muscle. Like, for instance, where are you going to look for a muscle that's called the brachialis muscle? In the arm, yes? You know not to look for it anywhere else. What does the name rectus femoris tell you? It tells you straight up and down over the femur. Yeah, exactly. Okay. Where are you going to look for muscles that are called intercostal muscles? Between the ribs, yes. It's exactly where they are. Intercostal muscles. By the way, the intercostal muscles have the same pattern as the oblique muscles. They run obliquely as well, even though it's not in their name. And the external intercostals are both external in two ways, more lateral, more superficial, and they are X to the sex, external intercostals. And the internal intercostals, same pattern, internal in two ways, right? Both more medial and deeper into the chin, right? They have the same pattern, okay? Especially if you look from the anterior. Posterior is harder to look. Where am I going to look for a muscle called the temporalis? Yeah, it's running over the temporal bone. Now, what if I have three muscles? These three muscles are all great or vast, but I'm telling you where they are with reference to one another. I've got a big muscle on the outside, a big muscle in the middle, and a big muscle on the inside, right? So they are called the vastus lateralis, intermedius, and medialis. Good? All three big muscles. Makes sense, right? Okay. Where do I find, first let's see if we can figure out what kind of information is in that name. I'm looking for a muscle called the flexor digitorum, and I've got a superficialis and a profundus. Okay, first help me find where the hell, pretend that I am my very, very bright 13-year-old son who's never learned this before, but I can teach him this pattern of where to look for things. How do I teach him where to look for the flexor digitorum superficialis? What does flexor tell me? Anterior surface. What does the digitorum tell me? Going all the way into the fingers, right? And what about superficialis versus profundus? Superficial versus deep. Does that make sense? Right? Okay, so, does that make sense?
Yeah, you mentioned it the very first day of class, so I've always remembered it.
The flexor digitorum.
Yeah, you just randomly said it. I'm like,
Flexor digitorum. I don't know why I said that. I was going to talk about the first day. I was trying to get people to drop. What? No, I'm just kidding. So the flexor digitorum superficialis, and then its friend is the flexor digitorum profundus, which is going to go to the same joints, right? And actually going to be deeper. Does that make sense? So, FYI, if any of you guys are like me, and most of you are not, I know a little bit about learning styles. Those of you who are very, very interested in words and etymology, You can actually go from this to the cadaver instead of from the cadaver to this. And this works way better for me. Like I know on the anterior surface that if it's the flexor carpi radialis, it's going to run down the anterior surface, it's going to be on the lateral side, it's going to cross this joint, but not that joint. Check, right? And I know that if it's the flexor digitorum superficialis, it should be running superficial all the way into the fingers, right? Right? And then the profundus should be over there, and then the flexor carpi ulnaris should be over here. That gets me half the damn muscles just by knowing what the words mean. If you guys are not word people and you're visual people, you will probably go at it the other way. There is literally no right or wrong way to do it unless you come up with the wrong answer every damn time and then try something else. Okay? Okay? Does that make sense? Okay. So yeah, I'm a word person. Okay. So how about two muscles? One of them is called the supraspinatus. The other one's called the infraspinatus. Okay. First, you'd have to know what spine you were talking about, but I'll tell you, it's the spine of the scapula. Where do you look for the supraspinatus? Above. Where do you look for the infraspinatus? Below. And you could probably tell something about what their action would not be. Like, would the top one be involved in depressing the scapula? No, because that's dumb. What would the bottom one, right? Right? So there's a bunch of information in here that helps you figure out what is complete BS, and then you don't say that, right? Whether you come up with exactly the right answer or not is a little practice, but at least you know what the wrong answers are. Like, that doesn't make a damn bit of sense. Okay, and then sometimes muscles are named for their shape or their structure. And so, of course, the deltoid. Yeah, it's shaped like a triangle. And how many of us remember enough geometry to remember what a trapezoid is shaped like for the trapezius? What? Yeah, it's kind of like a diamond. So you got this big muscle back here that goes from here to here to here, big diamond on your back. That's the trapezius. That's why it's called that. Good? Okay, now you haven't met this one yet. You will next week, but it's called the quadratus lumborum. What does quadratus imply to you about its shape? Yeah, it's a four-sided, it's a little rectangle-looking muscle, and where should it be? Right there, and that's exactly what it is. All right there. Four-sided muscle, right in the lumbar region, one on each side. Good? Okay. Serratus anterior. Now, what is the serratus part telling you? Jagged. Oh, I wonder if this could possibly be it. I'm sure you all look just like this when you take your shirt off. I know I do. This serratus anterior right there, right? Serrated edge wrapping around the anterior surface, hence the serratus anterior, right? And it's right next to, what's this one again? Be more specific. External oblique. Yeah, go ahead, Bridget.
Can you point out the serratus again?
Do you see it? Just serrated edge right here?
Yes.
Yeah, that's the serratus anterior. So it starts from the backside and it wraps around and it's really serrated at the edge, right? Serrated like a serrated knife, like a steak knife. Yeah? Good? Okay. So that's the serratus anterior. You might not know the prefix plat, but you will if I tell you that that's where duck-billed platypus came from. What's plat mean? What do you think your puss is? Not that. The other one.
There's another puss?
Yeah. Mouth is your puss. Yes. So platypus. What's plat mean? Flat. Yes, it's a big flat muscle. You've got a big flat muscle called the platysma. You're going to learn next week. Sounds like a platypus, right? Perry the platypus. You've heard Perry the platypus, haven't you? Do you not watch Phineas and Ferb?
I hear about it every
Back in the day.
My kids watch Phineas and Ferb. It's actually one of the cartoons I don't hate. If you try to make me watch Caillou, I will break the damn television. Parents in here? Any parents in here let your children watch Caillou? You are making some whiny-ass children. That's all I'm telling you. Like, I don't like this. Okay.
So, I'm sorry, for Platysma, should we say flat?
He does not have alopecia. He's just an asshole. Go ahead. Go ahead. Caillou. Just go watch it.
Oh, okay, that's what I thought.
Go ahead.
Oh, I was just asking for the example.
Oh, okay, platysma. Okay, sometimes muscles are named for their size or their relative size to one another. This is important. Listen to this part. If you run into a muscle that either has long head versus short head or longus versus brevis, you with me? It does not refer to the length of the muscle. It refers to the length of the tendon, which can be completely counterintuitive. If you, for instance, are looking at the triceps and you're like, why the hell is that the long head of the triceps? It looks shorter than the other one. It's because the tendon is longer. So long versus short heads or longus versus brevis has to do with the length of the tendon, not the length of the muscle. Because they hate us all, right? I don't know. Probably because the tendons are easier to find than the muscles when you get down here. Yeah, they're way easier to find than the muscles. So, did you learn any longus muscles this week? Flexor digitorum longus. What? Adductor longus. Exactly, good. And did you learn any brevis muscles this week? Adductor brevis. There's some brevises up here as well. Again, the length of the tendon. Okay.
Adductor,
Adductor.
AD.
AD. Yes, on the inside of your thigh. Yeah, adductor. Yes. Good? Everybody good? You don't need to write all these down right now. You don't even know them yet. It's just blah, blah, blah for now. Later on, you can write them down. Okay, I'm just trying to get you to hear the example. And for those of you who haven't...
Are these walls just really thin?
Huh?
Was he really yelling?
I don't know what the hell was going on yesterday. I thought I was loud.
Maybe the
Um,
walls are just really thin.
No, we might need to move. Okay, a muscle that is vastus is great or big. Yes, that's why it's called a vastus. You know some vastuses? I don't know if that's plural at all. I just made that up. You know some vastuses? Vastus lateralis, intermedius, and medialis, which are all part of the what group? Quadriceps femoris group. Okay. If there is a major and a minor, they're called major and minor relative to one another with sizes. Yeah? So you have two major and a minor that you learned this week. Yeah? You learned what? Teres major, teres minor. Teres, by the way, means tube-shaped. So the teres major and teres minor that both go right here, and the long head of the triceps goes between them. Minor over major. Did you learn this one? Did you learn the rhomboid major and minor this week too? The rhomboid are rhombus shapes, right? Little rhombus shapes. And there's a minor over major for that one. You'll also have the zygomaticus. So that's relative to the other one, relative to its pair, the minor of the major. Pectoralis, minor over major. By the way, with minors, usually the minor's on top of the major except for the pecs. Then the minor's underneath, right? But it's really easy to tell the pec major from the pec minor, right? Okay, but what about Maximus, Minimus? Maximus is the biggest, and Minimus is the smallest, and sometimes there's an intermediate one in between them. Do you know any Maximuses? Gluteus. Yeah, good. Yeah. You guys know gluteus, maximus, medius, and minimus. Those are all with reference to one another. The biggest, the middle, the smallest. Good? Okay. All right. And then this is how I wish that all muscles were named, but they didn't ask me, and it was way before my time. So if muscles were all named by their attachments, we would immediately know a lot of useful things about them. Because when muscles are named by their attachments, they're always named origins before insertions. So if you have a muscle that's called the brachioradialis, it immediately tells you where the damn thing is, yes? And if you know that the origin is named first and the insertion is named second, then you also can figure out a hell of a lot about what it does, right? Right? Wouldn't that be a fantastic way to name muscles, especially since you already learned all of those roots to begin with? I would like to speak to the manager. My name is Karen. I would like to speak to the manager. Sternocleidomastoid. Okay, so this one is also named for its attachments, origins first and then insertion. Sterno, cleido implying clavicle, mastoid process of the temporal bone. Good. Okay, I want to play with this one a little bit. I want you guys to practice because it's a weird ass muscle. You're going to learn it next week. Okay, so I want you to put your hands on your neck, and then I want you to contract both left and right sternocleidomastoid muscles simultaneously. Then you do this, yes? What is that action? Flexion of the neck, yes? Okay. But here's some weird things. What happens is if you flex one of them without the other, it does a completely counterintuitive action. So watch what I'm doing. I'm going to flex the sternal head of the right sternocleidomastoid, this one right here. Do you see it popping out right there? Do you see it? Okay, and what is it doing? It is turning my head toward the left side, which seems counterintuitive until you look at how it's strapped up, right? I'm going from the middle all the way out to here. I'm contracting that one and pulling it to the left side. Isn't that strange that you're using a muscle on the right side to pull something toward the left? But that's because its origin is over here on the center. So now do the other one. Turn your head toward the right side and figure out which muscle is tightening. It's the left, right? Sternocleidomastoid. Isn't that strange? Now, if I use both heads right here of the right one simultaneously, I will do that. Good? Do you see that? And you can feel them, right? You can feel them going all the way up to your mastoid process, tightening, right? Okay? If I use both heads on this one, I will do that. Good? So, you got it? You kind of see it? Mazzy, you look confused.
What's this muscle right here?
That's a platysma.
Oh.
That's a
okay.
thin one. So we're looking at this one. These two, you can feel them on yourself, right?
Oh.
So there's a head right here, there's a head right here, and they both go up to the mastoid process. Okay? So do this, and then feel it tighten right there. You feel that muscle?
Oh, yeah.
Okay? That's the right one. So, although it's counterintuitive, and when you write it down, it looks like BS, right? So, what do both of these do if you contract them simultaneously? Flexion of the neck. If you do one, this is called lateral flexion. Okay, both heads. But if you do just this head of the right one, it actually turns the head that way. Can you see how you would read that on your lab manual and be like, that literally makes no sense whatsoever? What? It's called rotating the neck. It's not the same as rotating these. It's a different action, but it's actually rotating the neck. Good? Does that make sense? Okay. So, by the way, let me reinforce that this cheat sheet that you have, you can bring with you everywhere. Yes? So if you get to the point that you can actually reinforce an action of a muscle by doing it on yourself, nobody gives a crap what you look like during a lab practical at all. Nobody's looking at you. It's like trying to do yoga. What happens if you try to watch other people when you're doing yoga?
You'll fall.
You're going to fall over. Same thing during the lab practical. You mind your own business. As long as you flap it around, you don't knock anybody over. You can do whatever the hell you want. Like try to do whatever the hell you want. Because those movements, I want to tell you, when you start understanding muscle actions, if you do it, it sticks better, right? It also makes the logic sort of work better. So that's the sternocleidomastoid. This one you don't learn, but let's see if you can look at it and figure out where it might be and what it might do. Sternohyoid. Yeah, it actually does what to your hyoid bone? Pulls it down. Yeah, pulls your hyoid bone down. It's really deep in there. It's hard to find, but at least you can like see an example. Okay, so, and then last but not least, the last way that muscles are named are by the number of origins. And listen to this because it's important. Okay, muscles that are biceps share always a common insertion and have two origins. Biceps, two origins, common insertion. That means less memorization. If, for instance, you know that both heads of the biceps brachii will share exactly the same insertion, then all you have to do is find the origins, yes? Both heads of the biceps femoris, two different origins, common insertion, right? Okay. The triceps, three different origins, common insertion, yes? And then the group that we call the quadriceps femoris group, all the same insertion point. Four different origins, common insertion. Okay? It gives you less to memorize. Go ahead.
So with the organs, no matter how many organs there are, is there always going to be the same insertion?
Exactly. Yes, that's what biceps, triceps, and quadriceps means. So that's why the group is called that. This group is all called a biceps because I've got two different origins in the same insertion. It's called a triceps because I've got three different origins, same insertion, quadriceps, four. Yes? Okay, that gives you less. And of course, it puts their functionality really similar. I'll get your question in just a second. With the exception of the fact that, let's go back to that example that we looked at before. This quadriceps group that we've got here on the anterior surface of the thigh has 4 muscles, yeah? They all share a common insertion that goes down here onto the tibia, okay? But one of them actually crosses this joint as well, right? So they're all going to have this action in common, but then this one is actually going to have an extra action, right? And again, that's not memorization. That's understanding what the hell the relationship is between origins, insertions, and actions. Does that make sense? Go ahead.
So when you're looking at like the different forearm
Mhm.
muscle, and it goes to 4 different, all the digits,
Mhm.
does that have 1 point?
No, not necessarily. Some muscles do have a common origin, but the fact that something is named a biceps means it has a common insertion point. The fact that it's named a quadriceps means it has a common insertion point, right? So they either do or don't with other names. There's no consistent logic to the other names, right? It's just that what particular thing is telling you, right? Okay. So 4 origins is a quadricep. Okay, so now what I want to do is I want to look at some names of some muscles, some of which you've learned and some of which you haven't, and figure out what you can determine just from the name of the muscle. Not just where it is, but can you determine what it might do and what it definitely wouldn't do as far as actions? That's what I want to think about right now. So if you find a muscle that's called the Tibialis Anterior, you should know where to look for it, yeah? Okay, because some jackass made you learn all the damn parts of the tibia, right? So the Tibialis Anterior is on the anterior surface of the tibia. Obviously that's easy, but now I want to know, thinking person, tell me what it might do. Be more specific. If the Tibialis Anterior is on the anterior surface of the tibia, it doesn't cross the knee joint, crosses the ankle joint. Tell me what it might do. Dorsiflexion. Definitely not plantar flexion. Yes? Good? Does that make sense? Okay. So, a muscle called the temporalis. Where am I going to look for it? Temporal bone. But let's be a little more specific. Logic tells me that it's going to bring the insertion closer to the origin, and I have literally never seen a muscle that pulls the skull closer to the mandible, right? So not only do I see it, but I also can figure out what the likely attachment points are, and from that I can figure out what the likely action is. Does that make sense? So what do you think the action might be if it goes from here to here? Elevates the mandible. Exactly. Yeah? And so where's the origin? Probably up here, and the insertion is down here, because the other action would make a damn bit of sense based on the body that you have had for a long time, right? You're like, I've never done that. I've never held my mandible stationary and pulled my head into it. Okay? I haven't done that. Okay, so a muscle called the supraspinatus. Where are you going to find it? Above the spine of the scapula. What is it definitely not going to do? It's definitely not going to depress the scapula, right? It can't depress the scapula, right? Now you'll go and figure out what specifically it does, and that depends on its attachment points, but I know what it doesn't do, right? Okay, the erector spinae muscles. What is the name telling you? Straight up and down, close to the spine. So, even if I hadn't taught it before, does your logic tell you that that muscle is going to do flexion or extension of the vertebral column? Why? Because it's where? On the dorsal or posterior side? Exactly, yes. Right? Because that's where you're going to find extensors. Good? Okay. Flexor carpi radialis. Okay. Help me figure out where that is and how I would know it when I found it. It's a flexor, so it's on the anterior surface. It's running across the what joint? The wrist joint. And it's on radialis. Tell me where to look for it. Lateral surface. Exactly. Right? Lateral surface. So that's where you're going to look for that one. Right? If you see its tendons going all the way into the fingers, it's probably not a flexor carpi. It's probably a flexor digitorum. Yes? Good? Okay. How about my extensor pollicis longus? What is in that name? An extensor. So tell me where to look for it. Posterior side. Which joint is it moving? The pollex joint, yeah. And why is it the longest? Longest tendon. You actually don't learn the brevis because it's too hard, but there is a brevis. Okay, that one's just like way buried in there. Good. Okay, and then depressor anguli oris we already did. What is this telling me? Vastus intermedius. Big and in the middle of two other ones. Yes, big in the middle of two other ones. Levator scapulae. Tell my 13-year-old kid how to find the levator scapulae and why you knew it was there. Scapula elevates. How do you explain to Evan how you would know that the it elevates and where it would be? Superior surface. But how do you explain to him? Because he's smarter than all of us. He just needs the information. Because muscles only pull, they never push, right? And to get it to move up, you have to attach it to the top side and pull from the top side. Yes. So there's a tremendous amount of logic that's involved here. Everybody good? Okay, questions. And then I will teach you what we call the forearm formula. The forearm formula is how to understand the logic of forearm muscles.
Sorry, I forgot. What do we write for the depressor anguli oris again?
Oh, well, you don't have to know that muscle, but what did you learn from the name? It's a depressor, so it's going to be on the bottom side from the angula or the oris of the. Is that good? Okay. Okay, that's not a muscle that you actually learn. It's really tiny and right there on the face. Okay, so let me teach you guys. Anybody have their lab manual so I can look at it for examples? I don't want to do one that you guys don't know.
Yeah.
Okay, just hand me your lab manual real quick.
This is last year's.
Okay. So I'm going to teach you guys a little bit about the forearm formula. That's what they call it. I just want to make sure I use the right examples. Okay. Where are you, you little bastard? Oh, that's the leg. Okay. Appendicular muscle. Okay. Okay. So with the forearm formula,